Hello, everyone, and thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. All right, we're ready to roll. We're so excited that you've joined us today. Please take note that additional resources are available at the Loop on the hospital website. Our presenter today is Emily Ward, Associate Chief Nursing Director from our hospital's leadership team. The topic for today is maintaining wellness at work and at home. During her presentation, we will hear ideas for striking a balance among competing responsibilities, especially during this challenging time of COVID-19. Here to tell you more, without further ado, is Emily Ward.
Hi, everybody, and thanks for having me. Today, I want to talk to you about maintaining wellness, not only at work, but also at home, and how you can balance that equally. During this time of uncertainty, leading can be challenging, day-to-day work can be challenging, and we can be pulled in multiple directions, but we can also be pulled in multiple directions while we're at home as well, and we have to learn how to pivot during these times of uncertainty, during these times of change, when things are thrown our way when we least expect it, and figuring out how to manage that change can be challenging. So I hope today to provide you with some strategies, not only for when you're at work, but also when you're at home. And I'll share some examples of what I have been doing over the last couple of months to try and maintain this balance. So the first thing that I want to talk about is our current reality. We face a very challenging time today, right? Very uncertain time, a time in which we are being faced with changes every single day. And this is happening in our workplace, but also in our world place and in our home lives as well. But for a second, I want to focus on what's happening at work. So specifically here in the hospital, things that are directly impacting me we're experiencing lower volumes, right? We went through this phase where we had to really ratchet down everything, really protect our patients, protect our employees. And that's what we spent the first couple months of our emergency preparedness doing, was figuring out how are we going to care for these COVID-19 patients. But in response to that, what we've seen is decreased volumes. And that's what we wanted, right? We wanted less people in the organization. We wanted to not do, non-essential surgeries to protect patients and their families, as well as our staff. But the result of that is then also lower revenues. So when you have lower revenues, you have to figure out how are you going to cut costs. When you're trying to figure out how to cut costs, you're faced with some really hard challenges and some really hard decisions. And for those of you that have been listening into our CEO, Suresh, his forums this past week, or his town halls, he's been talking about what some of those hard decisions look like. And so as a senior leadership team, we're having to figure out how to balance all of that while still continuing to figure out how do we continue to care for our day-to-day patients, how do we care for COVID patients, and all of this trickles down to our frontline staff. And that looks like change, right? The pace of change then is unprecedented. So our staff, whether they're being asked to do a different job. So we've got, staff that maybe were kind of pulled back from their work because we had decreased volumes. They're being asked to step into different roles, whether it's our screening stations, at our entrances, or helping to support our inpatient world and our patients. People are being pulled in different ways, and we're asking them to be really flexible in the work that they're doing to better meet our needs in the here and now for our reality that is today, and also planning for into the future. In the Department of Nursing, we trained up over 1,000 staff to care for patients in a different type of setting. For instance, we took some of our intermediate care nurses and we did some just-in-time education for what would it look like if you had to care for a patient on a ventilator, or what would it look like if you had to care for a patient that was on some vasoactive medications. We did the same thing with our perioperative staff and our ambulatory care staff. We said, hey, if we need you on the inpatient side of things in our medical surgical units, here's some just-in-time education to help prepare you for that, because we may need you. And so that is completely flipping someone's world upside down, right? Their day-to-day work looks completely different now, preparing for something that seems like it's the unknown, but it very well may happen. On top of that, we had all of these PPE changes, our personal protective equipment. Those things were changing every single day. Do I wear a shield? Do I wear a shield and a mask? Do I wear a gown? When do I not wear a gown? Where do I wear it? When I'm in my office, when I'm out on the unit, when I'm seeing patients, does the patient wear a mask? You know, do the visitors wear masks? And then we changed our visitor policy, right? So we said, first we reduced to 1 visitor per patient, and then we went to no visitors. And now we're having conversations about how we start to bring that back a little bit. And so all of these changes are being communicated from senior leadership to middle management to frontline managers to the front lines. And there's not just 1 or 2 of these every single day. There's multiple every single day. And we're trying to figure out the best ways to communicate that. And, you know, the other thing that I would say is that not only are we facing these challenging times and these ever-changing scenarios, but so are our patients and our visitors, right? I was leaving work the other day, and I was walking past the Pomerantz entrance, and I followed out a patient. She was being wheeled out, and she had a bandage on her hand. And so the OR staff was wheeling her out, so I could tell that she had had surgery on her hand. And her husband was picking her up, and the look on his face, it kind of blew my mind, because it was such a sense of relief. And then it made me remember that he hasn't seen her since he dropped her off for surgery this morning. His wife, that's going in for what we probably think is a simple hand surgery, but still had to go under general anesthesia and receive medications. And, you know, usually we're used to having those loved ones with us during those times of uncertainty, and we've restricted that, you know, to protect our patients and our staff, but it's also really hard on them as well. So while it's hard on them, we're also then expecting our staff and ourselves to step up to the plate to be advocates for them and to be there for them during these trying times when their loved ones can't be with them. The other thing in terms of challenges that we're facing, you know, are financial challenges. We're experiencing a big loss because of those reductions in revenue, and that has significant implications on what we had planned for the next year in terms of, you know, projects that we wanted to do, or people that we wanted to hire, or positions that we wanted to create. All of that has kind of blown up, and we're kind of waiting for the dust to settle to say, how are we going to do this now? When the immediate future is kind of unknown. And I think we're all being asked to do more with less, right? We're being asked to figure out how do we be more efficient, but just as effective. And that can be really hard to think differently and to think outside of our day-to-day norms. And then when we kind of pivot and think about how our world at home has changed a little bit, at least for me, some of the thoughts that I had initially were, what if I get COVID? What's going to happen to my family? Am I going to have to go in the hospital and not have my husband with me, not be able to see my child? And, you know, what if my family gets it? What if my son gets it? What if my husband gets it? What if my parents get it? You know, my mom has some comorbidities that put her at a really, really high risk. And she's a nurse. And so she's being exposed each and every day too. And, you know, that in itself comes along with a lot of anxieties and stress. And then for me specifically, you know, then my thoughts went to, what if I bring it home to my not my patients? What if I bring it home to my family? I don't work in direct patient care anymore, but, you know, I'm in this environment where I'm around patients, and that fear of bringing it home to them. And then I think, well, not just me, but think about all the frontline providers and how they must feel when they're coming and taking care of our COVID positive patients, or being in environments where they're there and figuring out, how they're best needing to protect themselves so that they don't take it home to their families. And then, the thought crosses your mind, what if I lose my job? What if my husband loses his job? How will I provide for my family? These are times of uncertainty. And I know that, I work for an amazing organization. And so that thought was quick-lived. But, the thought is still there, and it comes with those anxieties. Then I started to think about, what if my daycare closes? What am I going to do? Is my husband going to be able to work from home? Am I going to be able to work from home? How am I going to be able to work from home because he's 18 months old and is going about a mile a minute and I can barely keep up with him? How am I going to be on Skype calls while I'm trying to chase him around? So, luckily I've been able to stay at work. Luckily my daycare has remained open, but those are, fears that are constantly kind of on the horizon, the what ifs. And then thinking about, when can we go out again? I don't know about you guys, but I've been, excited to go to Costco. I've been excited to go to Hy-Vee. But the reality is, we don't know when we're going to get back to what was normal. We may never get there again. And again, those unknowns can cause us kind of that pit in our stomach, or that knot. I've also thought about, like, when can I be alone again? When can I love my husband, love my son, love my parents, but I need some me time too, and I come to work and I'm around people all day here, and then I go home and I'm around my family, and I can't see my friends, and all of my contact with them is now via Skype or Zoom or FaceTime, and so that presents its challenges. For several weeks, we kept my parents as well as my husband's parents away from us and our child, not just to protect us, but to protect them, because I didn't want to potentially give them something. And that, honestly, that was probably one of my biggest stressors, because I thought, like, when am I going to be able to see my parents again? When are they going to be able to see their grandchild? And you can only FaceTime so much before that really starts to wear on your nerves as well. And then, the other challenge, or, fear, anxiety that is constantly in the back of my mind is, how much money am I willing to spend on my home improvement projects over this summer? Because I've got a list a mile long, and it's like, that feels like the only thing that we can do right now is projects on the house, because we have all this time to do it. So figuring out how much money we're going to be willing to dump into that. So, these are a lot of things that are either changing or that are constantly on the forefront of our minds at work and at home that weren't there pre-COVID. And so figuring out, how am I going to manage all this? How am I going to manage all this stress? And when they asked me to do this forum, it really challenged me to kind of take a step back and say, what have I been doing? And has it helped me? And as I was thinking about it, I decided I wanted to share some information with you all that I use in my day-to-day work that I think is incredibly helpful. And it's about sticking to the facts. It's about understanding what we know to be true. It's about understanding what part of our stories are creating stress, what part of our stories are reality, and knowing that ultimately our stress comes from our stories, not our reality. And having a better understanding of what we can control and all that. This comes from the work of Cy Wakeman. She is the founder of Reality-Based Leadership. I don't know if any of you have heard of her. If you know me and know me well, you know that I am a disciple, is what I call her. And her work I was introduced to probably about 10 years ago when I was a new assistant nurse manager in the SNCU. And since then, I've really adopted her leadership style. But essentially, what she challenges folks to do in her leadership style is to be reality-based, right? Figure out what is the truth, not let yourself create these reasons, stories, and excuses that are really driven by your ego, right? Allowing that constant voice that's chiming in our head that's always making us a victim. Realizing what that is, realizing how that's affecting you and how that's affecting the stress that you're feeling. And so when I was thinking about the strategies that I implement, a lot of it has to do with the things that I've learned from Sai in her work. Understanding what can I control, what is the truth, what is the facts, and what else is all of this peripheral story that I've created that's really causing my stress. Sai, one of the things that she talks about is figuring out where we can add value. So when I think about these challenging times that are surrounding us, and sometimes our heads are spinning, to be able to say, where can I add value? Where can I help? How can I help? And really stepping up to the plate to get to answers and to get to solutions instead of focusing on the problems or the changes that are all around us, because our circumstances aren't the reasons we can't succeed. They're the reasons in which we must succeed. Sai talks about how we add value between perfect circumstance and reality. So perfect circumstance, we'll never get there, right? The world will never be perfect 100%. The reality space is where we are at, and we have to figure out how we add value in between. If everything was just perfect, we would automate everything like Amazon.com, right? But it's not. And so figuring out how we continue to ask those questions, how can I help? How can I add value? And then putting some of that rubber to the road and figuring out how we move forward. Our egos lead us to a state of complaining and whining and moaning because we can be the victim in that. And it's important for us to realize that truly our stress does come from our stories, and knowing that our excuses and those types of things really feed into that. So finding ways to thrive in the moment, finding ways to control what you can control, understanding what your reality is, I think is really beneficial during these times of unknown and these times of stress. So when I think about the things that I do in my day-to-day world, whether it's at home or at work, first and foremost, I would say stay in your lane. Focus on yourself, your assumptions, your choices, and what you can affect your thoughts and behaviors. It's really easy to get out of our lane and to kind of get into that cycle of venting and complaining with our coworkers, or with your husband, or with your wife, or with your parents. And I tell people that that's how we were born and raised. When I was growing up, sitting around the dinner table with my family, and I'd listen to my mom complain about X, Y, and Z coworkers from earlier in the day, and I'd listen to my dad complain about the decisions that were made by his boss. And at the end of the day, those aren't things that they can necessarily control. And so figuring out how we take control of our assumptions and choices, and our own thoughts and behaviors, and really being able to let go of others because we can't control those. So to get a little bit more specific, I kind of thought through what are the strategies that I use at work during these really trying times and times of uncertainty. And first and foremost, I would say I reprioritize. So, and I do this on a daily basis. So there's a lot of fast moving projects that were going on pre-COVID that really came to a screeching halt when we had to kind of put all of that aside and put all of our eyes on COVID and say, how are we going to manage this? How are we going to prepare for this? We are in a state of emergency preparedness. And being okay with all of that coming to a halt. There were a lot of really great projects that we had really great momentum with. And when we were first kind of shifting gears to focus on COVID, I found myself frustrated because I was like, but we're making so much progress here. But the reality is we have to be able to reprioritize. So even now, as we're working through our strategies around COVID-19, reprioritizing what it is that we're focusing on, and making sure that I'm on the same page as my leaders and that my team is on the same page as me with what our areas of priority are. And that kind of leads me into my second strategy. So getting on the same page with your team, making sure that we are all aware of what the priorities are, and making sure that we're aware of who's doing what. A lot of these kind of quick response actions and strategies that we have to put in place, it's really important to make sure that we're not doing duplicative work. So making sure that we understand who's responsible for what and be as efficient and effective as we can. And then, making sure that I support my team. So, whether that is stepping up and say, hey, how can I help you with this project? Or whether it's just saying, hey, who can take the afternoon off today to go be with their kids? Or who can work from home next week? Or, when someone comes to me and says, hey, my daycare is closing, do you mind if I work from home 2 days a week? Being supportive of that and being supportive of my team who's also going through just as a challenging situation as I am. And then in return, asking for support from my team. So I was telling the gals earlier that my husband had presumed COVID, so had to quarantine for about 10 days in our basement. And I had to be a 24/7 single parent with my 18-month-old. And, he is nonstop. And there was no way that I was going to be able to work from home and watch him at the same time. And so I really had to ask for support from my team during that period. I had to hand off everything that I was working on because I had to be there for my son and for my husband. And knowing that I had the support of my team, it made it easy to make that transition. I also think it's important to connect with people. So when I come in the morning, I make sure that everybody at the entrances, I thank them for the work that they're doing, and I, tell them to have a great day. Same thing when I'm heading out in the evenings. Those are all people that have been pivoting, right? They're doing a different job than what they were doing a couple months ago. So making sure that, we thank them and connect with them. I also get out, talk to folks on the units, make sure that people know that we're here too, and we're here to support them. And, I think the most important thing is really thanking people for the work that they're doing, whether it's on the front lines taking care of COVID patients, or it's people that are pivoting and doing a different role. It's really important that people know how much we appreciate all of that. And then also taking time for yourself to leave early, come in late, be flexible with yourself, be flexible with your teams. For me, most days I don't take my son to daycare. I'm usually up and out of the house before him and my husband are even awake. So I like to be able to pick him up from daycare at least 2 times a week. So it's important for me to be able to adjust my schedule so that I can do that. And then, pivoting and talking about what are some of the strategies that I use while I'm at home. The first I would say is understanding what my cues are for increasing stress and anxiety. Over the course of time, I've realized that I can tell when I am becoming less attentive, when my mind is all over the place. I'm working on email, and then I'm working on my list, and then I come over here to work on this project, and then there's this document, and I'm kind of bouncing all over. That for me is a trigger that I have some anxiety going on for some way, shape, or form. Also, I've noticed that I get some chest tightening when I am starting to get anxious. And so for me, recognizing those things and being able to realize it in real time and then be able to do something about it to be able to mitigate that anxiety is really important. And then, responding to that stress. So a couple things that I do is I focus on my breath. So I'll close my eyes and really focus on my breath, going into my lungs, coming out of my lungs, feeling it go through my nose, feeling it go through my mouth. When I am at home, I like to do this exercise where I sit there and I try and think about how I can ground myself in the moment. So I try and think about 3 things that I can hear, 3 things that I can feel, 3 things that I can see, 3 things that I can smell. And it really helps to bring me to the moment and focus on what is right here and not all those thoughts that are flying around in my head. I've also learned to ask for help as a strategy. So whether that is asking my husband to pick up groceries, which, let's be serious, he does that every week because he's amazing. Or, reaching out to my parents and saying, hey, would you guys mind taking, Cyrus, my son, for a night so Troy and I can get a whole list of things done around the house. Being able to reach out and to ask for help is really important to make sure that, one, you're able to get the things done that you need to get done, but also that you're able to take time for yourself. I realized early on, there were a couple of nights early on into COVID that I came home and I had like full-blown meltdown. And my husband is a mental health counselor, so he like jumped into action and, really helped me realize that I had lost control of so many things in my world, right? COVID took control away of so many things in terms of not being able to see my parents or not being able to go shopping or, I had to wear a mask into work. I have to wear a shield when I'm here. There's all these things that are all of a sudden these mandates in my world that I have zero control over. So he helps me realize that I should focus on the things that I can control. So he let me organize his garage, which it's crazy. I was going around and I was like, where do you think this can go? Can we put this here? Can we put this there? How if we get some totes for this? And organizing the garage actually made me feel so good. And he said, it's because you can control it. So I took that opportunity to figure out what else I could control. So whether it was like organizing the junk closet or reorganizing the pantry or, things like that I could control in the here and now, I realized really helped me. I also realized while my husband was in quarantine that doing certain things with my son really helped me to de-stress and to let go of those anxieties. So, Cyrus and I would do projects. We sent letters to his grandparents. We would go for walks every day and go look at the ducks down at the pond. He has a little toy car that he loves to drive around. So we would do that, and really anything being outside he absolutely loves. So really making sure that, we take advantage of that time. And even post quarantine with my husband, I know that those things really help me to relax and to kind of let go of those stresses. So every night after dinner, we spend some time outside and really allow us to be together as a family. And then I would just say, expanding on that, really anything that's family or friends oriented. I find that, laughter is often the best medicine. So doing some FaceTiming with my girlfriends, getting some good laughs in there, taking the time to be with my husband, and disconnecting from our devices and committing to having some good conversation is really helpful as well. So all that being said, there's a couple closing competencies that Cy Wakeman talks about in her work that I want to toss out there for all of you. The first one is the ability to respond to adversity. I tell people that healthcare is like whitewater rafting. You either hang on and get through it or you're going to get left behind. And I feel that way about COVID too. COVID is whitewater rafting. There are rapids everywhere. And if we don't hang on and get through it, we're going to get thrown off and left behind. And so being able to take the changes that are coming our way and be flexible and be nimble and being able to pivot is really, really important. The second competency is a profound commitment to succeed in spite of the facts. So, our reality is what it is. And we have to realize that our circumstances aren't the reasons we can't succeed. They're the reasons in which we must succeed. And then competency number 3 is a will to resolve and move through conflict very quickly. So as challenges come our way or as conflict happens between us and coworkers because of, stressful situations, being able to problem solve in the moment and move past that and not carry around our thoughts and our feelings that ruminate in our minds is really important. So those are 3 things that I really value out of Cy's work. And I would recommend that if anybody is interested in knowing more about her or her work, she has a YouTube station that I subscribe to. So I get, a short video clip once or twice a week, which is a nice refresher. She has a Facebook page. She has a podcast called No Ego. She has several books that you can read as well that I think are very applicable in our day and age with needing to focus on the here and now. So if you're interested, reach out. Thanks so much for your time. I really appreciate it.
All right. Thank you so much, Emily. That was wonderful. And I realized as you were talking that I know your husband. It's a cool guy.
Do?
Yeah.
Good.
So I have a few questions for you before we wrap up. And I think the first one I wanted to ask was about, you see hospital employees doing all kinds of things. Are there any things that have stood out to you as like ways that you see other folks managing stress at work that you think have been really, really good or stood out to you?
I think people working together in their teams and really relying on their teams. I don't know if that decreases their stress, but when I see the camaraderie and when I see the closeness that some of these teams have, especially these teams on the front lines of caring for these COVID patients, having to really step up to the plate and totally change the way that they're giving care, they have to be in it together, right? Because not only are they taking care of a different kind of a patient population, but their workflows are totally different. All the PPE that has to go on, all the PPE that has to come off. And not just, the nurses and nursing assistants, but EVS, food and nutrition, physicians, I mean, you name it, it's everybody on the multidisciplinary team. So I think all of them really coming together and supporting each other on the front lines, I think it's a part of getting through all of this, right? It's about coming together and partnering that I think helps a little bit.
That's wonderful. I was just thinking as you were speaking that you probably see all kinds of different things that I have been thinking are so heroic, and people are doing them just as part of their everyday. So that's cool. Our next question is about, you talked about Cy Wakeman's work, you talked about reasons and stories and excuses. Could you maybe give an example of some of the things that people might say to themselves that end up being non-productive or don't really get them where they would want to be?
So I'll give you an example that I give when I talk about this stuff with my nursing teams. And it's non-COVID related, but I think it helps get the point across. So this happened several weeks ago, but I was driving to work, and I have an 18-month-old, so my time management skills are kind of not so great sometimes. So I'm driving to work and I'm running late, and I have a 7:30 meeting, and I am way behind, right? So I'm driving to work, I'm going over the speed limit, and I come up Highway 1 and I hit North Dodge. And right as I hit North Dodge, I get behind this car that is probably going the speed limit, to be quite honest, but in my mind was not going fast enough. And I immediately became angry and frustrated. And in my mind, I started to think like, who is this guy and why is he taking forever and why doesn't he speed up or why doesn't he move over? Now I'm going to be late and my boss is going to be mad and everyone on this call is going to think that I'm incompetent because I didn't show up on time. And I created this whole story in my mind, and I was angry, like I was white knuckling it behind this guy. And I realized it. I realized it in the moment that I had created, I had made myself the victim in that moment, right? And I was blaming myself being late on this guy in front of me because he was driving too slow. And the reality is the reason I was late is because I didn't time manage appropriately in the morning and leave on time. So I think that's an example where we allow our egos to create this story in our mind that makes us the victim, and we tend to just kind of ruminate on it and let it get bigger and bigger and bigger and cause us more stress.
That was a great example and not unfamiliar to me either. All right. Well, I think that's all the time we have for today. Thank you so much for sharing your knowledge with us and talking to us about some practical things that we can do to respond to the coronavirus. I want to tell our listeners to please tune in for new wellness forums weekly through the month of June. We look forward to seeing you all soon. And thank you so much, Emily Ward.